Welcome back to the Bryan Devore Connection. This is Bryan Devore. Today I'm here with Janae Quintana and Chelsea Kennedy from Windward Life Care and Home Health. How are you guys doing today?
Very good. Thank you for having us.
Good. I am very glad you guys are here. I'm a big fan of Windward, and I wanted you to come on to talk all about it. So, Janae, tell us about Windward Life Care.
Well, Windward Life Care started in 2004 as a locally owned and run company. We provide services for San Diego's older and disabled population, helping them to age well, have independence and quality of life. We have care management, we have in-home care aides, and we now have the nursing through Windward Home Health. I think the best way to describe care management is that we help with the long-term care systems, the healthcare systems, and providing elder advocacy.
Well, and that's super important because a lot of times seniors are not able to advocate for themselves, and if they don't have family around either locally or at all, who do they have to advocate for them? So
Correct.
That's where you step in.
And the other good thing about Windward is that most of our care managers are certified or working towards certification. And we are also members of the Aging Life Care Association, and by being part of that, we're bound by their strict code of ethics. And that makes us different from just any care manager. You want to look for someone who's a little bit more qualified. And being a ALCA member, we have education that we have to keep up. So we're continually learning of different ways to work with clients, and we also work with elder law attorneys, estate planners, and trying to find the best way, again, to help the population age well, stay in their homes as long as possible, or helping them with that transition, which is sometimes very difficult.
Right, and we work together. I helped with one of Heather's clients. Heather is one of your team members and helped one of their clients when they had to transition into senior living near where the family was living because they were living down here. So you work all over San Diego County?
Yes, we cover all of San Diego County, which is very large.
Yeah.
We actually have a client in Fallbrook, or Bonsall, and we have clients down in Chula Vista. We have a client in Lakeside, and of course clients out in La Jolla and the beach areas. So
everywhere in between, pretty much all the borders of San Diego. And so really you're assisting them a lot of times with the activities of daily living is what we talk about.
That's what our home care aides do in the home, is they make sure that those activities of daily living are being covered with assistance. And they're safe doing them. The great thing about Windward Life Care, which makes us a little bit different, is all of our home care aides have to go through a 10-hour Compass Care training. So when they come in, they can say, well, I'm good at transfers, I can do this and that. We have an RN who actually works with them and makes sure that they do have the abilities. So that way, for our care managers, like myself, we're confident when we do the care matching and sending a caregiver out to the home that they will have that ability to help with a moderate transfer or a higher level of care. We also make sure that they have dementia training. We do monthly trainings are offered. We do SAGE training. We do dealing with clients with behaviors, how to work with clients with dementia, how to help them take that shower and make it comfortable for everybody involved instead of it being a battle. And the care managers help supervise the home care aides. So if they have a question, they can call and say, this didn't work, what else do you have as a solution? And also the home care aides can then rely on the help that we have through the home health division with the nurses, and we do med management through them. And if the home care aide notices a change in condition that might require the nurse's attention, then we have that division as well that can help with that.
Perfect. So yeah, good segue. And so home care is different than home health. So Chelsea, that's where you come in. Tell us about home health. How is that different from home care?
So the terminology can be difficult, especially if you're kind of a newer family member exploring options for yourself or your loved one. So home care is typically the services that Janae was talking about, activities of daily living. So bathing, dressing, meal preparation, making sure that the house is kept up, those types of things. Home health is typically more medical-based tasks that need to be accomplished. So typically those are done by RNs or LVNs, which are the nurses that we have on our team, and they can do things like the medication management, which is simply just the organization of all of those different medications into a pill box so that we can make sure that medication compliance is being adhered to. We also do other things like injections, G-tube feedings, ostomy care, basic wound care, those types of kind of more nursing types of tasks.
Got it. So sometimes if someone maybe is being discharged from a nursing facility or something like that, they're going to need some home health maybe as that transition.
Correct. And the one thing that makes Windward different is that we are a private pay service. So typically when somebody is getting discharged from a hospital or a skilled nursing facility, Medicare does provide some level of home health that's covered through their Medicare benefits if they're on Medicare. Windward is kind of the solution after that Medicare benefit is exhausted, or if a family just wants extra assistance or help for their loved one.
Got it. And so switching back real quick to home care, that's pretty much private pay as well, is that right?
Correct.
Okay.
Yes. Long-term care insurance, some long-term care insurances do cover the activities of daily living, so they do cover a portion of the the long-term care insurances do help cover some of the in-home care, the non-medical.
Got it. Okay.
So when we do work with those companies, we provide the paperwork that's required, which is a long-term plan of care, the daily tasks. They require certain tasks to be done. And so it's nice and orderly, it's nice and computerized, and each 2 weeks we can go ahead and fax them over. And we actually got a referral from CalPERS because of that, because they like the way it's orderly and easy.
Got it. So it's pretty rare, I think, that you have a company that does both home care and home health. I'm used to seeing one or the other. So that's obviously a differentiator for you guys. What else makes you different from others?
Certainly our continuum of care is something that we've worked really hard to expand over the last couple of years. So we want to grow with our clients as their needs change. So they might start with care management for the first couple of years, maybe add in home care at some point, and then as things progress, maybe add in home health services. So we really try to be the total package for our clients and have all of the services that might be needed during their journey as they age well.
That's great. Well, you guys are invaluable to seniors who really need the help, and especially for the family members who need help for their loved ones. So thank you very much. Your contact information is on the screen. So for those of you watching this, you'll be able to see all their contact information. If you have a loved one who might need the services that they provide, feel free to reach out to them, give them a call, check them on the internet, etc. They're an amazing company. So Janae, Chelsea, thank you for joining me today.
Thank you so much for having us.
My pleasure. Thanks for watching.